Nervousness is one of the most common problems that exam candidates face, and those going through the OET speaking exam are no exception. Hi, I'm Richard Foster. Some of you may have met me before. I've been appearing in previous videos on the subject of passing the OET speaking exam. In fact, the OET speaking exam places demands on many levels, which we'll talk about a little later, but let's think about this for the moment. For one thing, in the OET speaking exam, you have to deal with a total stranger, the interlocutor. Then you're speaking in a language that is not your native language. You're then having to think about things like vocabulary, pronunciation, grammar, your accent. And if that's not enough, you're also aware that you have to demonstrate certain clinical communication skills in order to pass the exam. And then in 5 minutes, whew, how difficult is that? Am I making you nervous? Hold on, well, let's stop just for a minute before I have you running for the door. Let's just remember what effects nervousness have, and then let's get to some of the causes, and then we'll talk about reducing nerves in a way that prevents you from having them, hopefully, in the first place. How does that sound? A bit calmer? Good. Let's first talk about then the effects of nerves. The first one is the snowball effect. Once we start to feel nervous, that starts to impede our thinking processes. And we're all aware of this. We all know what that feels like. And then our mind can be the very thing that trips us up. In fact, in the OET speaking exam, we're asking our minds to broadly work at two levels. The first one is we're asking it to keep a high-level view of the whole exam, thinking about the stages and what comes next. We're thinking about the big things like the time, 5 minutes, and then the key skills we need to demonstrate, for example. But then, while thinking about these kind of high-level stages in the exam, we're also dealing with the specific points of where we are in the role play so far. For example, we might be in the throes of a diagnosis, and we can get wrapped up in that. But the problem is, as soon as we get wrapped up in that, we may start to lose the view of the bigger picture. Now we start to say, did I say this? Have I covered this point already? Maybe I haven't started it. Where am I? And it can get really difficult. What are the effects of nerves? Well, for one thing, our vocal cords constrict, the pitch of our voice gets higher, and our vocal cords actually begin to ache, making it even harder to speak normally. Then we also end up speaking faster. And in fact, nervousness can even start to affect our perception of time, which leads us to tending to think that there's not enough time to do everything. I can't get it all in. And it makes us nervous. And so we end up speaking faster, which actually makes it worse. So how do we overcome the nervousness in the OET speaking exam? Well, let's start with a bit of motivation. You're the boss. You're the doctor or the nurse or the other health professional qualified to be there in the first place. And this exam is not about medical or clinical knowledge. This is about forming a professional relationship with a patient, using something you have done since you were born, communicating. You understand? This is something you've been doing for many years. You were already good at it by the time you were 5 years old. This is just another patient. Are we clear? Good. Now, let's talk about how to stop your brain tripping itself up. Brain overload is self-inflicted. Yep, you heard me. You are doing this to yourself. But Richard, I don't start the exam intending to overwhelm myself with nerves or with too much information. Well, no, you probably don't. But let me quote you an inspired question. How do you eat an elephant? What's the answer? Yeah, I'm sure some of you are saying it. One bite at a time. This exam is about demonstrating specific communication skills. So break the exam down into sections. Make sure you're keeping this in mind. There are 5 main skill areas in the OT speaking exam, and they can be done by remembering 5 key events in the exam where you will gain marks. They are mostly sequential. So let me tell you them right now. Number 1, greetings and introductions. Number 2, echoing and summarizing your understanding of what the patient has told you. Number 3, create a plan for the conversation. I'd like to examine you, then I'll have some more questions, and then we can talk about the treatment plan. How does that sound? There's a plan. Then work through that plan using the skill of signposting, and we cover these skills in other videos. And then finally, ask the patient to summarize their understanding of what's been said. It's far easier to remember 5 key stages than every single little point in the exam, and then just focus on, at each stage, the skills that you may need to demonstrate with each stage. Otherwise, you'll create what might be called a cascade failure. One thing fails, it causes 2 things to fail, each thing causes more things to fail, and before you know it, you've got overwhelmed. It's simply a matter of practice, but practice remembering those 5 key stages. The reason behind this thinking is that a simple structure combined with practice means your nerves don't get fueled into action due to brain overload. Does that make sense? The next point is something now a little bit more psychological. I want to talk to you about a public speaking technique that I use. Now, I train people to do public speaking. I help them speak in front of large audiences and prepare and keep the audience attention and those types of things. One of the things that I do when preparing to speak in front of a large audience, 100, 200, 500, even 1,000 even, I need to find a way of centering myself or getting control of nerves before they actually become a problem. And this is a really simple technique. What I do is I'll have my notes on the rostrum, on the stage, on a table or on a stand. They'll be there already. I may have placed them there before I even get up on the platform so that I'm prepared to start speaking. But what I do is I'll approach the stand and I will stand in front of the audience just for a brief few seconds, and I will look around the audience. I may even smile at them, and it confounds them. Why isn't he speaking? Why isn't he starting? But I'm not doing it for their benefit. I'm doing it for mine. That moment, those 3-4 seconds of where I'm just looking around the audience, at the same time, I'm taking a breath. I'm calming myself. I'm reminding myself that I am qualified to be there. And these things I find set up my confidence levels from a good point, from a good start. And then from that point on, I find it easier to read the audience, to speak to them almost on a one-to-one basis. So preparing and spending a little bit of time looking after yourself, no one else's benefit, just you, will really, really make a difference. Try it and you'll see that it actually works. So I hope that was of some help today. We've certainly covered a lot of ground for dealing with nervousness. As we've said, it's a common problem. We've discussed 3 key ways of overcoming nervousness in the OET speaking exam. Let me just summarize them. The first thing is, remember, you're the boss. You're well qualified to be there. This is an exam about communication, which in turn is something you've been doing all of your life. And yes, you're probably already practicing some of the clinical communication skills that are mentioned by OET. This is just a question of forming that relationship and exercising those skills. The second point is memorize those 5 key points. You remember greetings and introductions, echoing and summarizing back to the patient your understanding of what you've heard, then create some form of structure, some form of plan for the conversation, use the skill of signposting to change direction in the conversation and proceed sequentially, and then finally ask the patient to summarize their understanding of what's been said. They're the 5 key points. Try to memorize those key point-gaining areas. And then the third point was prepare yourself for the exam. Remind yourself that you are fully capable of doing this. Remind yourself that you're the boss, as we said earlier, but also remind yourself to adopt some nerve-killing techniques. Take a moment before the exam. Take a breath. Just pause, and you will certainly find that it improves your nervousness even before starting the exam, which is the best place to start to combat nerves. So that concludes today's session. We've really covered a lot of information today, as we've said. We hope you enjoy it. But maybe please ask that you do us a favor, please. Please hit the subscribe button. Please hit the like button as well. And also hit the notification bell so that you find out every time we release a new video. Well, I hope that helped today. As I've said, next time we're going to be talking about how to avoid hesitation and repetition. So I look forward to seeing you in the next video. Bye for now.